Hello, cruel world. Anthony Joseph was aged 23 and he was suffering from paranoid schizophrenia when he killed Richard Whelan, aged 28, who was a complete stranger. He stabbed him 7 times on the number 43 bus in London in July 2005. So, what circumstances led to this tragic killing? What mistakes were made by the authorities which could have prevented the killing? What is paranoid schizophrenia? And a restriction order is like the specialist section of the Mental Health Act reserved for the highest risk patients. So, what situations is this used in? What does it mean? And how is it decided? I will answer all of these questions and many, many more. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So grab your salt and vinegar, sit back, relax, and welcome to A Psych for Sore Minds. So the perpetrator, Anthony Joseph, was from North London, which is literally where I am right now. And this incident happened in Holloway Road. It's about 5 miles that direction from here. Happened on the number 43 bus, literally the same bus that I used to take to work many years ago when I lived in Muswell Hill. The perpetrator, Joseph, threw chips at Mr. Whelan's girlfriend, 𝐏𝐬𝐬 Barker, who was aged 38, and also another random woman on a bus. And then Whelan went to defend his girlfriend's honour, confronted Joseph, who was laughing, and the scuffle ensued. And then Joseph got on top of the victim and he stabbed and killed the unarmed Mr. Whelan. Joseph had been drinking and taking drugs, and he was also known to smoke crack. According to what was said during the court case, he'd taken up his pent-up frustration and anger on the innocent victim. And he was dubbed the chip killer at the time. So to clear up any confusion for American viewers, what you call fries, we call chips. What you'd call chips, we call crisps. What you call potato fries, we also call crisps. What you call sneakers, we call trainers. And what you call medium, we call extra, extra large. Only kidding, America. You know I love you. You're Bombay. So Anthony Joseph had been released from prison earlier that same day from a Young Offenders Institute in Manchester, and he was there for the abduction and unlawful sex with a 15-year-old girl, although he was released after the allegations was dropped. But this is the interesting bit. He was released despite having an outstanding warrant for his arrest. So he should have been detained because he was supposed to be facing charges related to a burglary offence. Mr. Joseph was suffering from the onset of paranoid schizophrenia, where he carried out an attack. So I've done a separate video on what paranoid schizophrenia is and what it isn't, because there's a lot of misconceptions. I won't go into a lot of detail, but very briefly, schizophrenia affects 1% of the population. Paranoid schizophrenia is the most common type. Generally, it's periods of psychosis, so periods of stepping outside of your normal baseline functioning, as opposed to, for example, something like a personality disorder. Also done videos on those. And the typical symptoms tend to be hallucinations, often hearing voices, or delusions, which are fixed, unshakable beliefs. In paranoid schizophrenia, as the name suggests, they tend to be paranoid or persecutory delusions, such as random people or specific individuals want to hurt you, or trying to follow you, want to stab you, want to kill you, are laughing at you, spying on you. I assessed a man fairly recently who thought his next door neighbour was a paedophile. It's completely untrue, it's just a delusion that he had. I've seen people who believe that they've got special powers, etc., etc. Just to be 100% categorically clear, I'm not saying that most people with schizophrenia are violent. They certainly are not. They're more likely to be victims of crimes themselves, but there are a small proportion that are violent. Those are literally the ones that I assess for a living. Often their delusions and their hallucinations lead them to committing violence. So please don't get the wrong end of the stick. You're Bombay. During his trial in 2007, Anthony Joseph admitted manslaughter due to diminished responsibility, and 2 individual juries at the Old Bailey could not agree whether he was guilty of murder or not. So, diminished responsibility is a partial psychiatric defence. You can only use it for murder, not for any other offence, any other charge. So pay attention, nerds, because here comes the science. The kind of medico-legal criteria for this is there has to be a defect of mental functioning coming from a recognised medical condition, so it has to be like a diagnosable psychiatric illness like schizophrenia, which has affected one of three things during the killing. So the defendant either cannot understand the nature of their conduct, they cannot form rational judgment, or they cannot exert self-control. And the onus is on the defence to prove it, and if the prosecution don't agree, then the onus is on them to disprove it, and they do that by instructing forensic psychiatrists who go and assess the defendants, write these expert witness reports, hand them into the court. Sometimes we go on the witness stand to give evidence. That's what I do, that's my day job. So, as the name suggests, diminished responsibility means that the criminal culpability is reduced, but it's still there to a certain degree, so there's an element of responsibility. Kind of a bit like when you snogged your secretary at the Christmas do and tried to blame it on the eggnog. As I said, this defence only is for murder and it reduces it to manslaughter. So murder, the judge has to give a mandatory life sentence, there's no leeway, whereas manslaughter is up to the judge's discretion. So, as you can tell, it makes a massive difference to the defendant's life. Diminished responsibility is different from not guilty of reason of insanity, which is full exoneration, and that can be used for any offence. I've talked about that in many different videos in the past. Go chickadee, check them out. So, either psychiatric defence can lead to hospitalisation, and in the case of Anthony Joseph, diminished was accepted, indicating that his schizophrenia affected his actions to a degree. What I've read about this case, Joseph's future was down to the doctors and the Ministry of Justice. So to me, it sounds like he was disposed with a restriction order. So restriction order is section 41 of the Mental Health Act. He was sent to Broadmoor High Secure Hospital on a hospital order, which is section 37. So I want to tell you what is a restriction order. As I mentioned at the beginning of this video, it's reserved for the highest risk patients. And again, you need evidence in court from a forensic psychiatrist. And I've done this. I've given evidence about restriction orders several times in my career. I'm about that life. Other YouTubers talk about it. I live it. Before I tell you about the restriction order, I have to tell you about the hospital order, because you can't have a restriction order without a hospital order. You can't have a section 41 without a 37 first. So a hospital order means the defendant is sent to a high secure unit instead of prison. So Mr. Joseph was sent to Broadmoor High Secure Unit rather than prison. By the way, loyal viewers will know this from a previous episode, but I've got a question. Can you guess how much it costs to treat a patient in a high secure unit for 1 year? The answer, I guarantee you, is mind-blowing and will relieve any constipation that you might have or your money back. I'm going to tell you later on in this episode. So going back to a hospital order, this is like an indefinite sentence, although it's technically not a sentence because it's an admission, because it's a hospital, not a prison, but you know what I'm saying. Unlike a finite prison sentence. So in hospital, it's not about the time that's passed, but it's about milestones. For example, medicating symptoms of mental illness be one milestone, psychological therapy, looking at the factors that lead the defendant to offending, drug and alcohol rehabilitation, which would have been relevant in the case of Mr. Joseph, occupational therapy, and then leave testing, so testing patients out in short periods of leave in the community to make sure that they're safe to be discharged one day. Different timescales for different patients. Usually that entire process takes years, sometimes even decades. By the way, if you're interested in Broadmoor, and if you're a true crime fan, then you almost certainly are, you should see my series on high-profile Broadmoor patients. Not only do I talk in more depth about the rehabilitation process and how it works, and about the security levels in Broadmoor and what it's like working there. I worked there myself several years ago, but in this series I talk about a number of infamous previous detainees like Ronnie Kray, Charles Bronson, David Copeland, who's the London nail bomber. I delve into their backgrounds, I give you my own psychoanalysis. It's dope, you gotta go chickadee, check it out. I've even done 2 separate videos on this channel about 2 people who actually killed other patients in Broadmoor. Robert Maudsley is one of them, he's like an English serial killer. Peter Bryan is another one. He actually is dubbed the Broadmoor cannibal because he's actually eaten people's brains. I kid you not. Go check out those channels, those videos, I mean. I've even done another video about a hostage situation in Rampton, which is another high secure unit like Broadmoor. I give you so much, dear viewers, so much. And all I ask for in return is a little sprinkle of recognition, tiny bit of fame, and a little bit of world domination. Okay, so when a defendant has a disposal of a hospital order, then usually they're under the care of a consultant forensic psychiatrist. So that person is in charge of major decisions, including leave, eventual discharge from the hospital. I actually did this role myself for a couple of years in various secure units. However, with a restriction order, the defendant is so dangerous, so risky, that the Ministry of Justice gets involved in their, I wouldn't say in their care, but in certain decisions. So the Ministry of Justice share the risk and possibly the blame and embarrassment if something goes wrong, if that person goes on to offend or to kill, and if it ends up in the prison, if it ends up in the press, in the headlines, etc., etc. So with a restriction order, the Ministry of Justice oversees decisions such as discharge or leave, or if the patient's going to step down to a lower level of security. I have to say, from my experience, these restriction orders are a lot of administration, lots of paperwork. I'm not convinced they're helpful because from my experience, what happened was I would make a decision like this person is ready for leave after many years of rehabilitation. And then I'd have to apply to the Ministry of Justice, and it's just a very slow process. And they come back and they ask several questions such as, is the patient not pushing boundaries on the ward? Are they attending their therapy? Are they taking their medication? But here's the bit, like, I considered all of those things anyway, obviously, otherwise why would I make a decision for somebody to have leave? So it feels like I just have to justify clinical decisions that I've been making or thinking about on a daily or weekly basis for years anyway. So I suppose what I'm trying to say is, to me personally, I didn't really see the point of them. They just seem to kind of slow down the process by a couple of months. And almost always they would end up agreeing with my decision anyway, so I kind of wonder what the point is. Anyway, that's my personal view. Other forensic psychiatrists might think differently. To me, it's that classic case of, what's that saying? Too many chefs ruin the soup. Wait, hang on, I got that wrong. Too many food preparation experts damage the stew. That's it. Can't believe I almost messed that up. You Bombay. After discharge, a defendant is followed up and observed in the community by the Ministry of Justice with a restriction order. And this happens possibly for years. So as you can tell, this is like a big impingement on the defendant's civil liberties. And it's also a major use of resources. So later on this episode, I'm going to tell you how a psychiatrist such as myself makes the decision that somebody is risky enough to need a restriction order. Okay, I asked you before to guess how much it costs to treat a patient in a high secure unit for 1 year. The answer is
coming up shortly.
Before I answer that, I'm just going to introduce you to this channel. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess people in prisons and in courts and in secure psychiatric units, like I've just been talking about. You can call me the ominous Sohominous. This is my homeboy Megatron, leader of the Decepticons. I am your favourite Indian Asian forensic psychiatrist based in London / YouTuber, or at least in your top 3. This is a Psych for Sore Minds. I deliver you a smorgasbord of episodes on topics related to mental illness or criminality, or the crossover between the two. I look at high profile true crime cases. I talk about how gangs relate to offending and mental health. I've done a video on a video series on psychopaths, including working for a psychopath, what that was like, the difference between psychopaths and narcissists. I've done videos on polygraph tests, how they work, how to beat one. What I'm trying to say, if you're a fan of crime or mental illness, you've got to subscribe to this channel. Not only will it help me out immeasurably, but if you subscribe, you will never spill a pint in a packed pub ever again. You never have to look around all embarrassed. Guaranteed, or your money back. Okay, so I asked, how much does it cost to look after one patient in a high secure hospital for 1 year? Drum roll, please. The answer is £275,000, somewhere between that and £300,000. So talking almost a third of £1,000,000 a year. So if you guess within 10%, then you should buy yourself a cookie and you can bill me. But if you've got the answer from watching this when I asked in a previous question, then you can also have a cookie for your loyalty. Again, just bill me. I've got your back. I'll sort you out. Okay, moving on. How are restriction orders decided? So there are many different defendants, so many different offences, lots coming in and out of the system. So how do we decide that this person is one of the absolute highest risk? How do we know that they need a restriction order? Well, the judge asks for evidence from a forensic psychiatrist, such as myself, and we look at 3 different categories. And the categories are the nature of the offence that they're in front of the judge for, the alleged offence, the antecedents, which is kind of a posh word for things that have happened previously, like the past, and risk of harm of committing further offences now if the defendant is set at large. So very briefly, I'll give you quick examples of cases that I've dealt with within all 3 of those particular categories. So, the nature of the alleged offence. Well, Anthony Joseph would be a perfect example. So obviously he's killed a random stranger, very serious. I assessed a young girl called Yasmin, not her real name, who was an 18-year-old girl who completely out of the blue, without any warning triggers, became psychotic and killed her 3-year-old nephew while she was babysitting him. Tragic, horrific, really emotional case. I've talked about it at length throughout one of my other videos. Go check that one out. Antecedents, so reason to give somebody a restriction order. I once assessed a man who was a prolific sex offender, especially when he became manic, which is a phase of bipolar affective disorder. He would become disinhibited, speeded up, lack of boundaries, and he would go and sexually offend. When he was arrested, it was only for a relatively minor offence of flashing, so that wasn't serious, but I still suggested he needed a restriction order because of the antecedents, because of the serious nature of his previous offences. And for the third category, risk of harm of committing further offences if set at large, I've assessed people in the past who suffered from auditory hallucinations, so that's hearing voices commanding them to hurt random strangers. So that's just to give you an insight of the kind of the decision-making process of a forensic psychiatrist. Okay, let's keep it moving, because I ain't got no time for shucking and jiving. To conclude, this is an absolutely tragic case. It was a senseless murder, although technically it's not a murder, it's a manslaughter. My heart goes out to Richard Whelan. In terms of gaps in the system and the failures, Anthony Joseph should have been detained due to the other arrest warrant. So if that happened, then the killing probably wouldn't have happened. So this shows a breakdown in communication, which I have to say is something I experience regularly working within a prison, within a healthcare system, within psychiatry in general. So what did we learn? We learned about the circumstances of the catastrophic event. And as I say, my heart goes out to the victim, Mr. Richard Whelan, and his family, and also his girlfriend who had to witness this. We learnt that the perpetrator, Anthony Joseph, the chip killer, he got a finding of diminished responsibility, indicating that he's not fully criminally responsible, but kind of partially. I told you about this psychiatric offence and when it's used. We learnt about paranoid schizophrenia. We learnt that too many nourishment creation engineers destroy the chili beef ramen. I think that's the phrase. I explained to you what a restriction order is. So it's a specialist section of the Mental Health Act that's reserved for the highest risk patients. I told you about the situations it's used in and how it's decided. So, dear viewers, I'm interested to know if any of you have had any confrontations with any random strangers, particularly on a bus. I'd love to hear your stories. Please tell me in the Schmom and Schmection below. I love having a chat with you guys. Before I go, I'm just going to shamelessly once again promote my book. It's going to be called In Two Minds by Sphere Publishing, released in March 2022. You got a copy. I'll be talking about a whole range of my own cases, so it's quite autobiographical. I talk about my life, about the journey of becoming a forensic psychiatrist. There's a lot more cases in it. You got to go cop it. Before I go, also, please tell everybody you know, your friends and your enemies, about this channel. I would love for it to grow further. I need more subs. I need validation because I'm a shallow man. Until next time, whatever happens, stay euthymic and do not forget, I love you.